Hello, everybody, and welcome to the Animal Care Wednesday webinar. I'm Heidi Carroll with South Dakota State University Extension, and the Animal Care Wednesday webinars are a multi-state collaboration between SDSU Extension, Iowa State University Extension and Outreach, University of Missouri Extension, and Nebraska Extension. We thank you for tuning in today to kind of hear some expanded topics in our special December series on animal care topics. Our series has been focusing on applying ergonomics to animal handling, and it's a very timely topic, especially going into winter and some of our performance seasons, and also keeping in mind how we can take care of ourselves in those times. A couple of housekeeping items. We will use the chat box to take any questions. Feel free to type those at any time. We will usually address those at the end, repeat those questions, and have the speaker answer them. Don't see anybody having any technical difficulties, so I think I will go ahead and turn it over and introduce our presenter for today. Today, we have Dr. DeAnn Adams, and Dr. D has been great to get to know a little bit. She comes from Paradox Chiropractic over in Minnesota. She'll expand a little bit on her background herself in her intro, but she has a very unique background experiences in both human and animal chiropractic. And I think when we think about ergonomics and agriculture, it's an area that maybe doesn't get enough attention, both on the human safety and treatment side, as well as on the animal side. So thank you, Dr. Adams, for joining us today, and I'll turn the floor over to you.
Well, thank you, and very happy to be here and have the opportunity to answer questions, do a little education, and help protect people and their animals. Are you hearing me all right?
Sounds good on my end. Thank you.
All right, perfect. So I kind of have a whimsical looking PowerPoint slide here about animal and people crackers, because there's a joke with children when I treat them that sometimes they think an adjustment sounds like a little dog treat or a cracker, and some people come in and say, I just need a good crack. And I kind of cringe because I don't want to crack anything, pun intended, but we do like to adjust. So that was what came up as kind of a paradox. That's the name of my practice. And that's kind of a pun also, because my mother thought it was a horrible name, that it meant a false truth. And that's what we find a lot of times is a lot of people still don't think it works, that it's placebo. And in reality, we have scientifically proven that it does work. So that was kind of the pun and whimsical reason for choosing this sort of a slide presentation. Slide. Heidi.
Looks.
Slide.
There we go.
There we go. So there's my sense of humor. I can't help it. I was born sassy and I'm still sassy. And this is actually a release of comfort, yawning, a very happy horse customer, if you will. But that was the joke, was that I was cracking up the horse. And really there is no cracking involved. In fact, when you adjust an animal, a lot of times you don't hear what some people describe as a crack. It's also known as a cavitation, is the sound sometimes released when we adjust a joint. But it's certainly not the goal of chiropractic, and definitely not the goal in animal chiropractic. So that was kind of the clarification and a little bit of whimsy and humor, because I just can't help myself. I am sassy. So you can't refer anybody to me unless you warn them. Slide. So it's kind of a myth, and chiropractors are crackers and quacks. And the truth is we aren't, and we don't crack your back or neck. Quack was a term that got tagged to us by the American Medical Association. And that started way back in the 1800s when they were throwing us in jail. And then in 1963, they actually had a committee that was designed to try to defame us. And I have a reference at the end of the PowerPoint talking about that. And then in like 1980, 80s, they ended up in court fighting and finally got it resolved. And they had to back off and realize that there was a Sherman antitrust issue. So they could no longer try to do that, that patients and people should be able to choose who they want to see, whether it was a medical doctor or a chiropractor. So that's kind of where the expression quack or cracker came about. And it's still sort of follows us today. Like I said, I still have patients come in and they don't mean to be derogatory, but they'll come in and say, yep, I need a good crack, doc. And okay, kind of roll with it. So we don't quack or crack. We just adjust restrictions. And these adjustments may or may not, like I said, have that audible crack or pop. So that's a myth. That's the truth of it. Slide. And that said, the doctors of chiropractic have many, many years of chiropractic practice in perfecting their adjustment after years of academic study. And it does parallel the medical students' academia. They have more in pharmacology. We have more in, say, nutrition. But otherwise, our education is almost identical. So one of the things then people would say, well, so what do I need to go to a chiropractor for? My neck doesn't hurt, my back doesn't hurt. Well, if you want optimal health, we believe you should come in whether you hurt or not occasionally to make sure that you're optimizing neurologic function, because that's the purpose and the result of a high quality chiropractic adjustment is we are restoring joint motion that influences the nerve function, which affects all the systems in your body, as well as helping muscles function better, more powerfully, more quickly, all of that. Your reflexes improve. So we see that both for animals and people. Slide. If it's good for you, it's good for your animals. And I truly believe that. This is Lacey is a longtime patient, and she actually now is my chiropractic assistant. She has given me permission to release her identity, and she's on her horse, Lacey. She found when she met me, she actually met me at a rodeo, and she was having a migraine, worked on her migraine, and then she wanted me to work on her horse. Her horse had a reputation. She'd just gotten her of not being a very nice horse. She didn't really tell me that, but as you can see, that's Lena that I'm adjusting. There's nothing naughty about that horse. Very, very cooperative. And that's the thing is, if you are well trained and truly trained in animal chiropractic, you know how to work with the animal and gain their trust before you start making corrections to their spine. So slide. That said, as the years pass, it's been almost 10 years since I've been working with them, and both the horse and rider improved, their performance improved. She's been a top rated barrel racing horse for 16 years, and she had her first injection this past year, and it was an SI joint injection. It was not a hock injection like a lot of people hear about. So that was pretty cool, since most of her competition, the horses are being injected as young as 6 and 7 years. So we know that chiropractic can help with joint issues, spinal issues, muscle reflexes, all those issues for the animals and the owners and the riders. So she had been suffering from migraines, but she also had a history of spinal fractures, rib fractures, shoulder injuries, and a chronic history of battling migraines. Those are all common injuries that you could run into yourself when you're working with animals. We were just mentioning that the timeliness of this whole series that South Dakota State University is providing you with. We're moving into winter, and that is a horrible time of year for us and the animals, because we're all prone to slipping on ice. And if you slip when you fall, well, most of you have experienced that. If you live in the states that Heidi mentioned, most of you are probably tapping in from. Missouri, maybe not as much, but you guys, when you do get it, it's heavy, thick, and wet. Anyway, moving on, that great team is an example for all of us. Lacey will credit that her continuing to compete with the Minnesota Rodeo Association, that's the MRA, that's credited to the chiropractic care and in her and Lena's consistent ongoing performance. So that's pretty fun. Slide. So cattle, horses, sheep, goats, dogs, cats. Some other funny things I guess I did were rabbits. Somebody asked me to do a chicken. Nope, haven't done that yet, because I asked them if they would manage the beak and the feet, and the owner laughed and said no. And I said, well, there you go. So that one is out there yet, but it is fun. It is different. The cattle, when it comes to adjusting cattle, I only adjust show cattle because they already have some ground manners. And most of the folks that I work with that are showing cattle, they know what I need from the animal in order to collaborate and work with the animal to have an adjustment be safe and have the adjustment get accomplished. So horses also, I like, if they're young, I like them to be halter broke, and that's fair enough. And that's mostly so that we can manage, keep the colt or filly safe, as well as ourselves safe. I've done dairy goats, worked on sheep, like I said, dogs, both agility dogs, herding dogs, pet dogs, domestic cats, barn mousers. All of those have presented to me for chiropractic care. So as we already said, slipping on ice, your barn cat gets trounced by the neighbor's stray tomcat, and now it's not able to mouse. Well, that's been some of the calls I get. So I go out, work with the cat, and most of the time it works out pretty well for the cat, and the barn owner gets their mouser back. So it could be just about anything. I've had people approach me because there are fertility issues. Well, chiropractic's been proven to help with that as well, because by optimizing the nerve function for the reproductive organs, all of a sudden the heifer takes or the mare takes. So one case of some 4-H sheep, the ewe, after she'd had a struggle delivering, was unable to get up. Well, you don't want a bum lamb unless you have to have it, right? So I was called out, worked with that ewe, and in a visit, we had her on her feet. We did one follow-up and she was fine and the lambs were suckling fine. So those are the types of things that I do as a chiropractor. Let's see what else. There's just a little bit of information. There isn't a joint in your body that, as a diversified chiropractor, which is what I am, that I can't adjust. I can do your fingers, I can work on your cranial bones, I can work on, which are your skull bones, toes, fingers, all the things that are listed on that slide. Not all schools train as diversified chiropractors. A straight chiropractor only learns how to adjust the spine. And the belief there is that if the spine is aligned, everything else will take care of itself. My theory and belief, based on my education as a diversified chiropractor and my own personal experience, having started seeing chiropractors at age 5 because of a farm injury, is that if I lived in an ideal world, yes, my body would take care of itself and heal from its injuries. It's called innate, your inner ability to heal. But because we don't live in an ideal world, I believe sometimes we need to adjust a shoulder, an elbow, a hip, a knee. So that said, that's the difference between a diversified chiropractor and a straight chiropractor. They both worked. They both basically are working towards the same goal, getting you back, getting your animal back to its optimal health and function. Now, if a chiropractor is wanting to work on your animal, or a veterinarian is wanting to do chiropractic on your animal, you want to make sure that they have advanced training specifically in animal chiropractic. I had been asked to adjust family dog, friend's dog, before I was trained at Options for Animals in Kansas. And the way that I would figure out how to adjust those dogs, it helped, but the dogs usually didn't like it. And I would never adjust those dogs the way I was once I learned the proper way to do it. They benefited, but they didn't like it. And now, for the most part, animals like being adjusted unless they've been hurt by someone previously, and the adjustment setup reminds them of that incident. Slide. So here's an attitude of gratitude from this show heifer. She was short striding on her right hind, and that was the call that I received and went out to help out. Went through, did a lot of safety things. Right here, she's already pretty comfortable with me, so I'm not set up with my bales. The black box you see me standing on in the middle picture are called mounting bales. So they stack so I can get high enough for a tall horse to be up and above and get my angles right for adjusting their spine. But in this case, they also act as a bit of a barrier, and they're going to probably hit the bale first. Yes, I might go flying, but I might not break a leg. There's nothing safe about working with animals, even with advanced training. And if you're in ranching and farming, you know that firsthand. So we always have to know that they're not domesticated. In the case of this one, she wanted to sniff me. I already knew she was happy, and she licked me. That is pretty funny. So that's been kind of our joke, is that they do show you appreciation after an adjustment. Very much like children, the response in animals is pretty much immediate. You either did it and got it, or you didn't, and they'll let you know. Children are the same thing. There's no such thing as Minnesota nice when it comes to chiropractic with children and animals. So they don't pretend they're okay when they really aren't. Slide. So myth 2 is getting older hurts and it ends your livelihood. The truth of the matter is, yes, injuries can bring our game, our livelihood, or our life to a temporary halt or an abrupt end. And I've seen videos of people getting cow kicked through stanchions and I can't even think of the word right now. Somebody else will have it out there. And actually getting hit in the chest and dead on the spot. That's not the way to do it. So some people think if they put them, in some sort of a stall, they're going to be safe or stanchion. No, there are other safety things that you learn in advanced chiropractic training to try to protect yourself as well as the animal. But that said, we do know that the wrong injury can take our lives from us, or definitely permanently change your life when you're working in agriculture, and especially when you're working with animals. So these injuries, they can occur at any age, and chiropractic is for all ages. I see newborns, both animals and people, and I see seniors. The whole span of lifetime is worthy of chiropractic care. And a lot of people again say, well, if my back or neck doesn't hurt, why? Again, because it's going to optimize the function of all your systems in your body. And people that get on that preventative plan swear that that was the best thing they ever did, because they'll often come and I'll say, well, what are you here for today? And I'll say, I don't know, it's been 3 months. I'm here for my seasonal tune-up. I'm like, that's great. But then when you start working on them, they realize just how sore they are, because we do learn how to tune out our pain. And animals are hardwired to block their pain. And that's why you can hit with your car a dog or a deer, bowl it over, and it will get up and keep running, because they're hardwired to keep moving. The dog keeps moving to get his supper. The deer keeps moving to not be supper. So they are hardwired to be able to pop up and continue to run at least for a while. We tend to be, whoops, I got to assess the situation and see if I can feel my fingers or toes before we try to move, unless we have training in military and law enforcement. Then they train and try to shift that hardwiring so that no matter what happens to you, you try to get up and keep moving. Because when you're down, you are a target in those livelihoods and professions. So farm injuries, agriculture, ranching, farming, doesn't matter. Chiropractic might be an option. Can I fix everything? Absolutely not. I can't fix a fracture. That's where the veterinarian comes in. That's where the medical doctor comes in. And wonderfully, we have emergency hospitals as well for both those professions. If I hadn't had emergency care when I needed it, I wouldn't have ever made it to the chiropractor. So it doesn't fix everything. It's not for everything. It doesn't help everybody, but a lot of times it will improve the quality of life. Even post-surgical, I find a lot of patients, both the people and the animals, will come to me and I'll get them to an even better quality of life than the surgery did, because of all the compensation prior to, say, the surgery for that bad stifle. Let's see, slide. So the injuries for farmers and ranchers, as already mentioned, are common. And they are neck and back injuries like sprains or disc injuries. Nerve root injuries are where your fingers and toes might be numb and tingly. You may have weakness in your arm or leg. Those would be disc or nerve root injuries. Limb injuries, as previously mentioned on the previous slide. Head traumas, those, a lot of people wouldn't stop to think about chiropractic, but I get referrals from the Minnesota head and neck, can't even think now, Minnesota head and neck trauma, have referred for craniosacral. I have a particular optometrist that does a lot of referring for TBIs, which are traumatic brainstem injuries, because they know that with my very gentle, light craniosacral therapy, which is working on the skull bones, as well as the neck and the soft tissue, that you can make a difference and try to clear up some of the dysfunction and brain fog that results from those types of traumas. Let's see. So as mentioned, then I do collaborate. I don't hang on to a patient and try to be the end all be all. If my patient doesn't see dramatic improvement and the owner of my patient isn't seeing dramatic improvement in just a few visits, I'm looking to refer or recommend other options, because I want the animal to be able to return to their job, return to their livelihood as soon as possible, because motion's life. Slide. These two, one was a rancher, one was a farmer, and two different traumas. The farmer was on an interstate, headed home. It's dusk, but all his lights are on. He's pulled way over. He looks in his rearview mirror and realizes the semi is not shifting, and he gets nailed. That was, he should have been killed. He realized he should have been killed. He wasn't, and he worked with me quite a while, but he had to do a whole lot of other things to get fully back to being able to farm and ranch. He does both some farming and dairy cattle. So he is a busy guy. But he is back and doing that, but it was a long haul for him. So I played just a partial role in that. He couldn't get in for this shoulder surgery that he needed right away. So a lot of my care was just managing the pain and keeping him comfortable until he could get in for that surgery. And then doing the cranial work while he was also working with a neurologist. So the second incident, I met this gal, and it was already 2 years after this steer hit a panel, knocked her back. She was knocked and her head bounced off the concrete. She was life flighted down to Memorial Hospital. And after working with them for about a year, they just said, you just have to live with your dizziness. She could not look up without feeling like she's going to pass out and throw up, and she'd lose her balance when I met her. And over the course of a few months, we were able to resolve that with gentle chiropractic and the craniosacral. So I'm not bragging up. I'm just saying that sometimes we have to look beyond what our medical doctor is suggesting and consider the alternative care and the collaborative care of chiropractic. Slide. With age, it may not look or may not look different. In this case, smarter, not harder is always my advice to people. The way I run, the way I do activities, the way I drop trees is different now than when I was younger, because I have to work smarter, not harder, or I hurt the next day and then I'm not any good to my patients. So smarter, not harder has been one of my long-term pieces of advice for my patients, because I want them to get back doing what they love to do. In this case, this 26-year-old endurance horse and his rider was 64, and they received distance national recognition, a lot of awards for one event. So the point is, she and the horse don't look like they did, 10 years ago, but they're still performing at a competitive level. So that's pretty cool. Slide. So even after previous injuries and traumas, that rider in the previous slide, she had both knee and shoulder repairs done. Her horse was at 20, had a stick drive into his coronary band and down his foot, had to have surgery on that. At 24, he'd suffered a head trauma and supraorbital laceration. I actually did some cranial work on that horse as well as chiropractic. And yes, the surgeons and veterinarians obviously played the primary care and the primary role in those types of traumas and injuries, but you're there as the backup for their recovery and the ongoing preventive maintenance. Slide. Myth 3, chiropractic is for old folks and old critters. No, here's a young 4-H'er. She's been multiple times a champion, both at county fair and state fair level. So there she is with her little herding dog as well, who is pretty young. Then in the lower left, that was were they 4 days old, those little puppies were, and they'd just been docked, and the owner was worried about the trauma of that and asked me to come and check them out, make sure that they would continue to suckle well and recover from their docking of their tails. So anyway, that shows you the idea of that we can treat newborns and infants and not hurt them. This doesn't look the same as how I would adjust the dog in the middle picture. Slide. So the working smarter, not harder, that's the safe way to go. Yeah, I can probably pick up 50 pounds and throw it on my shoulder and go out the door. I wouldn't even attempt to do that anymore. I used to, but not anymore because it's not the smart way to work. So being able to prevent our injuries and minimize the wear and tear on you and your body's animal is just taking that second to say, oh yeah, do I really want to lift that 50 pounds anymore by myself, or should I grab my son or daughter to get on the other end of it? Just those couple of quick seconds can save us a lot of pain and injury. That's why I advise people to have seasonal chiropractic checkups. It helps them optimize their health, and we get to catch concerns before they're problems. So that's another way of working smarter, not harder. Slide. How do you find a licensed chiropractor for you or your animal? Always go to your state board of chiropractic examiners. Doesn't matter what state, there is a state board of chiropractic examiners, and it will give you a list of licensed chiropractors in your area. For a licensed veterinarian, same thing. They have their own state board of veterinary medicine. So you can go there and find out who is licensed. You can also find out who's had a license revoked. Well, then you might wonder about having them work on you or your animal. For veterinarians, they can become certified in animal chiropractic. In a lot of states, they wouldn't even have to, because they're primary for an animal. They could do whatever they want to. I would highly recommend that somebody have the advanced training of animal chiropractic for the reasons I explained previously. Yes, I had adjusted a few dogs before I was trained in it as favors for family and friends, and I helped those animals, but they didn't like it, which tells me it hurt and it shouldn't have to hurt. So that said, law is different, and they differ from state to state. I found out, did my research for you folks, in South Dakota, I cannot adjust your animals. Even if I'm a licensed chiropractor in South Dakota, I can't adjust your animals. That's listed in the references where they talk about, that was the statement that I received from the South Dakota Veterinary Medical Examining Board. But go to the next slide, Heidi, the following slide. In this one, if you read closely, it makes the imposition, though, that I could, if I was under a prescription or supervision by a veterinarian. But that's not what I received from the veterinarian board in South Dakota. So you have to, you should anyway, if you want to protect yourself and your animal, go to the boards and make sure this person that says they are licensed really is. In North Dakota, it used to be if I was just a licensed chiropractor somewhere and I had the advanced animal certificate, I could go there and work on animals. That's not true anymore. I have to be an employee of a veterinary clinic in North Dakota to adjust an animal. So I have a North Dakota license, and I am employed on a very part-time basis by a veterinary hospital to help them out, because right now they're short just for their traditional practice number of veterinarians in their clinic. So I go and help with the overflow on the chiropractic piece. They do have a veterinarian trained in animal chiropractic, but she doesn't even have time to really do that piece of their hospital's work. So in Minnesota, I'm licensed, and in Minnesota, we have to have a veterinary referral for animal chiropractic, even if I have the advanced training. There are other credentials if you're interested in animal chiropractic that you can look for and that I recommend somebody have. Those are called International Veterinary Chiropractic Association, or which is IVCA certificate, or there's a AVCA, Animal Veterinary Chiropractic Association certificate. Those are also good things to have an animal chiropractor be able to show you that they have recognition with those associations, one or the other of those, because that just tells you they passed an additional layer of testing to prove that they can work on your animal and not cause harm to the animal. Slide. So those are the chiropractic references as far as talking a little bit about the quackery that we used to be known for. I don't have any doctors in Little Falls anymore that really have a problem referring or cross-referring with me, because I've been here long enough. They've seen what I can do. They know that I refer, and I don't pretend to be a medical doctor, so they have a lot of faith. And I don't have any trouble with the veterinarians in my area as far as getting a referral, because again, I communicate with them. I keep them in the loop. I don't pretend to be a vet. I refer back. So we've got that collaboration going. They aren't losing business by referring or collaborating with me. And it took a while to build those bridges, but they're there. The fundamentals of chiropractic just talks a little bit about how the adjustment works, which I referred to or referenced as far as how it helps your whole body. Slide. If you have other questions, don't be shy about emailing me, calling and leaving a message. If you don't hear back from me within 24 hours, I didn't get the message. It got buried. It probably came through, but it got buried. Don't hesitate to call or email or, again, reach out, because I do like to be able to answer questions and point people in the right direction for finding care, appropriate care for you and your animals. Any questions you can open up at this point, Heidi?
Well, great. Thank you, Dr. Adams. So for those on, feel free to either unpause and verbalize your questions, or feel free to use the chat box to ask your questions. To kind of kick off the questions here as I submit and launch our poll for today. When you think about animal welfare, how does your role, both on the human side and on the animal side, play that high priority to help maximize, or you kind of reference to optimizing animal welfare?
Well, again, it's whether you're talking about the owner of the animal or you're talking about a mother or father of a child. If the mother and father or the owner aren't healthy, they can't take very good care of the animal or the child. So it's important both for the animal and the handler to have optimal health so that they can both do their jobs. And likewise for people. I don't know if that was what you're asking, Heidi, or not.
Yeah, that was kind of the direction I was going. You started to talk about building collaborative relationships with those other health professionals. Can you expand a little bit on that? How did you build up that collaborative relationship with veterinarians and the medical professionals?
You did have to reach out, and a lot of it was just mostly by reputation and getting the job done. When a patient would come, maybe they had been told, no, you can't see a chiropractor, and they would approach me and I'd say, I'm going to do my best for you and I don't intend to hurt you, and improve them. I made sure they went back and let the doctor know what they had done. And over the course of time, that substantiated my credibility in the area, because I moved in from the outside of this community too. I wasn't originally from Little Falls. So that it did take time to get that faith in and establish that reputation. Same with the veterinarians. As soon as I received that animal certificate, because that's like, I'm going into my 11th year with animal chiropractic. I'm 23 years with people chiropractic. So that I had to directly kind of solicit, reach out to them, let them know that I was in the area, had gone through this training, offered to do demonstrations at their clinics or their practices. Some of them took me up on that. Others were like, no. And in a couple of cases where they didn't want to, a veterinary didn't want to give me a referral, the owner found another veterinarian that did. Well, then they got back to that veterinarian to let them see what had happened with the animal. And like I said, over time, the proof was in the pudding, so to speak. But it did take time. And there's still some bridges I'm trying to build, and it's been 10 years. Some people are just sort of stuck in their way, and that's okay.
Thank you for expanding on that. A question that came into the chat says, I know several people with sciatica, which has impacted their quality of life.
Yeah.
In your experience, can chiropractic care help with this condition?
Absolutely, but no guarantee. It depends on what's causing the sciatica. If it was a spur in a hip or in the SI joint that was causing it, they may need the surgery to get that spur off that nerve. I would probably adjust that individual. They would feel better for a while, but eventually that spur would be rubbing on the sciatic nerve and causing a great deal of pain. If they aren't doing their physical therapy exercises or rehab exercises, I might prescribe them. If it was the piriformis muscle, which is a common cause of sciatica, it's going to keep coming back because they have to do their part of, as far as stretching out that muscle to take the pressure off the nerve. If it's a disc causing it, sometimes adjusting the disc, getting the inflammation out, resolves the sciatica. Sometimes the disc is too damaged, and all we can do is acupuncture and gentle adjusting until they can get in for the disc surgery they need to take pressure off the sciatic nerve. So you don't know until you try and until you have a truly accurate diagnosis. And an MRI is going to show if it's soft tissue. All the x-ray will show would be like arthritis. It won't tell you anything about the nerve or the disc, but the MRI certainly can.
Great, thank you for that. Kind of 2 questions here to wrap up as people finish up typing their questions in the chat. What advice do you have for livestock producers and veterinary professionals when it comes to applying ergonomics to livestock related tasks?
It goes back to that saying, working smarter, not harder. We get in the habit of doing what we've always done, but our body is changing over the course of time. And certainly when we have snow and ice storms coming in like we do now, we can step on a slick spot and not even know it's there, and we just go down hard. There's no preventing that. That just happens. And in my case as well. So you just always have to try to anticipate your environment, the footing that you have, that you've got clear alleyways when you're moving stuff, that you aren't blocking your vision with a load that's above your eye view. It is, to me, it's like common sense, but when I'm in a hurry, I make mistakes just like the next person. That's why we're called humans. So we aren't perfect. But usually trying to look at the job and what would be the most efficient way to do this. Yeah, it might be faster to just dive in and do it, but I'm going to pay for it tomorrow. Why not have your son or daughter or that other farm hand, ranch hand come in and work with you? Don't know if that answered the question. Ask for more clarity if I didn't.
No, that was good. And kind of expanding on that a little bit, how have, or maybe they haven't, animal chiropractors had any challenges or issues from an anti-animal crowd or animal extremists? Are there any concerns there? Sometimes we see that on the farm and ranch level when we see animal extremists causing issues towards even just general care of animals. Are there any concerns or issues that have arisen in the animal chiropractic field?
Mostly it isn't so much with us that are licensed and trained in it. It's with the ones that have watched on YouTube or, Google, this is a chiropractic adjustment or adjust your own horse. We can teach you to adjust your own horse in a weekend. There are courses offered like that all over. That's where you're putting your animal in danger, because you can't learn anatomy and physiology and central nervous system and peripheral nervous system and reflexes in a weekend. You can't. Veterinarians have 8 years plus, chiropractors have 8 years plus in education. So what we do looks easy because of all the education and all the years in practice, perfecting what we do. So that would be the biggest cause and flack that's going on out there, that these people run around and $50 cash, I can do that for you. No trail, no license to lose, but if I don't get a referral, could have my license pulled. That's just the reality. It's a reality. That's probably the biggest thing that I see out there as far as flack or things that aren't right. So I don't know if that again answered and went in the right direction, Heidi, or not.
Great. And you actually brought one more question to my mind here before we wrap up. What advice do you then give to the animal owners to make sure that they aren't just watching you and then they try to replicate it without those years of experience and that years of education? Is there any concerns that you have with owners trying to do it themselves?
I actually have said to owners, because you can tell when somebody's trying to figure it out, watching and they actually are just trying to figure it out. I'll say, it looks pretty easy, doesn't it? They say, yeah, you hardly do anything. I said, and you could probably try to do this yourself. I said, but don't come crying to me when you hurt your animal. And they just look at you. They're a little surprised at me being kind of crass and just blunt that way. I'm like, because eventually you will. Because it's the same thing when you see young people doing this thing, right? And cranking. And I cringe, because I know what will happen if they get it just a little bit wrong. and they will suffer for weeks. If they sprain a ligament in the neck, it's horrid. And I've had them come crying into my office because they did that. And I said, I told you to not do that. No, what? Yeah. And that is a real common thing. I have parents coming in alarmed because their son or daughter is doing that. So those are our concerns, that it does look easy. And again, it's because of all the years and all the months in school and all those terms at chiropractic school perfecting the adjustment. So the main thing is when somebody says that they can do chiropractic, is say, well, can I see your license? And I'll bet you 10 to 1, even if they're licensed, they don't have it on them. I have it in my vehicle. And I can pull up and show them where I'm registered with the International Veterinary Chiropractic Association, with the Minnesota board, with the North Dakota board. I can show them that. So I don't know that all my colleagues do that, but they certainly should. And an animal owner should do the same. But what happens is they trust the neighbor, they trust their friend, they trust their rodeo mate, you know, and oh, they're doing well, it must be okay. Yeah, until that person gets it wrong. I actually had a horse that was so easy to work with, try to attack me when I approached with a bale. And he had been so collaborative, and it was because somebody untrained claimed they were a veterinarian, claimed they were a chiropractor. Turned out they weren't licensed for either. They had no chiropractic training, and they weren't licensed even in Minnesota. And they had adjusted this horse. It took us 3 years before that horse didn't bar his teeth at me and pin his ears when I walked up to him, because he thought I was going to hurt him like the other person. That's PTSD. Animals get PTSD. I will argue that till the day I'm in the grave, because I have rescued animals and I know they come with PTSD in some of those situations. And that's really hard to work through and painful to watch, because the animal is suffering, you know, as well as owners and people surrendering them in some cases. So I don't know if that answers your question again, Heidi, or not, but it's a matter of taking the time you've got so much invested in livestock or your horse or even a dog, and anymore dogs aren't as much utility as they used to be. It used to be all utility, or animals were utility, but now they're family members. Even if they have a job and play a role out in the farm herding, a lot of those dogs are still part of the family. They're in the house at night. They're not necessarily outside. So there's a lot invested in animals that I just can't imagine not asking the questions and wanting somebody to be able to show me that they're licensed to do what they say they're doing.
Thank you so much for sharing your expertise, your experience, and your knowledge and wisdom you've gained over the course of your career. I think that's been a very valuable piece to kind of our December series here when we talk about applying ergonomics to animal handling. I do want to remind everybody we've got one more Animal Care Wednesday webinar for 2021. So join us next Wednesday on December 15th, and where we're going to talk a little bit more on the dairy perspective and talk about applying ergonomics, as well as some training to improve the workplace. So I hope you can join us next Wednesday, December 15th at 11 o'clock Central Time. Thank you so much, Dr. Adams, for joining us.
Thank you for having me. It was a pleasure. I am passionate, as you can tell, about this. I'll be doing this for years yet, so God willing.
Agreed. Thank you so much.
Yep, thank you.